This is the first of many short video lectures about particular types of cancer in children, and this one is addressing leukemia. There are 3 or 4 other videos from the Khan Academy that explain leukemia, the treatment, the presenting symptoms, etc. So here's a couple of kids with cancer, and what do you notice about them? They're all young, because leukemia usually affects the younger children. And it is the most common cancer that it does occur in children. So we have ALL, AML, CML, CLL, and then infant ALL. So ALL, acute lymphocytic leukemia, is the most common of even all of these types. There is a much higher incidence of ALL that occurs with children who have Down syndrome. The prognosis is pretty good. It's about a 90% cure rate now. And the best outcome for age is when they're between 2 and 9 years old. When they're only 9 months, they're not going to do that well, but they do respond. So what happens with leukemia is they have a proliferation of white blood cells in their most immature state, and they're called blast cells. As a result of this proliferation, it crowds out all the rest of the cell lines. So we're going to see a decrease in their red cells and their platelets and the mature white cells. If a child with leukemia has an infection, that increases the mortality rate. What are the signs and symptoms of leukemia? Well, like I said earlier in a previous video lecture, at the beginning, all they have is they're pale, they may not be playing as they used to, and they might have a fever. When the parent finally brings them in and we do blood work, we see that the child has an anemia and a thrombocytopenia. When you look at this little child, that child is very pale. Look, they're almost as white as that piece of paper that's up on the wall. Eventually, the child has a lot of bruising and abnormal bleeding, and you can see this child has a little black eye. Eventually, they start to lose weight because they no longer have an appetite. They may have a hepatosplenomegaly, lymphadenopathy, and they have bone pain because of the proliferation of these white cells in the marrow. If they come to us and they have dyspnea, tachycardia, and palpitations, and a new heart murmur, this kid is not in good shape. The heart murmur is new because of the anemia, and they'll have a tachycardia because it's a new anemia. The infections that they may end up having are going to be the typical upper respiratory infection, which is viral, and then we can have a bacterial urinary tract infection. You can put the video lecture on pause so you can see the cell lines for ALL and AML. And you see how large that cell is on the lymphoblast and the myeloblasts. White cells aren't supposed to be that big. The diagnostics would be a blood count, chemistries. We will do a bone marrow aspiration, and from that they will be able to tell the particular type of leukemia that they have, and based on that we'll put the child in the protocol for treatment. They may do cultures, and then we'll also do a lumbar puncture. And we do this initially to see if we have CNS involvement, and they will go ahead and give intrathecal chemotherapy at the same time. So our treatment for leukemia is going to be chemotherapy, IV as well as intrathecal. After the rounds of chemo, if they're not responding, this child might be sent to St. Jude's for a bone marrow transplant. And then the supportive care, like I've said already, administering blood, administering antibiotics, antivirals, or antifungals as needed, giving the child good oral hygiene and treating infections. They might be on iron therapy to promote blood cell growth, and then giving the epogen, neupogen, etc., promoting nutrition, and then addressing the psychosocial needs. So this ends leukemia.